Cassie. My name is Marianne. I'll be your nursing assistant student today, and I'm going to help you with some peri-care. Is that okay with you?
Yes.
Okay. I am going to invite your visitors to step out of the room for a minute. Then I'm going to wash my hands and collect my supplies. Can you tell me your name and date of birth, please?
Cassandra Perez, 41388.
Thank you very much. And I see that's what it says on your bracelet. Okay, so I'm going to collect my supplies and I'm going to put them on a barrier. And I have one towel for a barrier, one towel to dry, 6 washcloths, 2 pads, and a bath blanket. Also, I have my gloves. And then I'm going to also get a basin with soap. I'm going to use a barrier to turn on the tap and get some nice warm water. I'm also going to pull the curtain to provide privacy for my resident, and I'm going to check the lock on the bed to make sure that the bed's not going to roll away. Okay, we've got warm water. Can you check the temperature of the water for me, please, Cassie? Is that okay? Thank you. Okay, I'm going to raise the bed up now that I know the water's a good temperature, so I don't have to leave the bed again. Raise the bed to working height so that my back is not strained. Are you going to get to go to bingo this afternoon, Cassie?
No.
Oh, I'm sorry about that. I'm going to take the bath blanket and spread it out. When I spread it out, it doesn't need to be neat or fancy. It just needs to not be shaken, and it needs to cover the resident. I'm going to also pull the sheet down to knee level so that it stays dry. Okay? Then the next thing I'm going to do, the pad that is under the resident right now is wet because that's why we're changing it and doing peri-care. So I'm going to prepare my under pad by rolling the clean side, fluffy side towards me. And I'll have that sitting ready. And at this point, I'm going to have you scooch towards me and roll away from me. And I'm going to roll up the soiled pad and tuck it under the resident. And then I'll put the dry pad under the resident, and I use the edge of the bed as a guide. And you're going to roll over a bump, then scooch towards me a little bit here, and I'm going to go around to the other side of the bed so that my uniform's not touching the soiled, and I will have you scooch just a little toward me, roll away. We'll get rid of the soiled pad, and that's going to go into the laundry. I'm going to unroll the clean pad, and you can lean back down. Thank you. Put the soiled laundry directly into the hamper. Now we have a clean working surface so that once we've washed, everything will be at least somewhat clean. I'm going to throw all 6 of my washcloths into the water. I'm going to roll the gown up in the bath blanket, and I'm going to use this extra towel I have over the legs, and I use it with the folded edge right close to the body so I can use this piece to dry and the legs will still stay covered. When I am washing, I'm going to wring out my cloth. This is cloth number 1. I'm going to put soap on 3 leaves, and then I'm going to fold the cloth, put the leaves against my palm, and I'm going to pull out just one of the leaves. I'm going to spread the labia, and the first swipe will go straight down the center. I'll fold that leaf out of the way. I'll pull up the second leaf, and go on one side of the labia, get rid of that leaf, pull up the third leaf, and clean the other side of the labia. Then this washcloth is done and I can discard it in the laundry. My second washcloth, I'm going to put soap on 2 leaves. 1, 2. Going to fold those leaves, tuck them by my hands, pull up the first leaf, and clean one side of the groin area, get rid of that leaf, bring up the second leaf, clean the other side of the groin area. Going to get rid of that one. The whole front has now been washed with soap. So I'm going to rinse with just water on my washcloth. I'm going to fold it the same way I did for everything else. Pull out the first tuck. I'm going to rinse down the center of the labia, get rid of that leaf. Rinse down one side of the labia, get rid of the second leaf. Rinse down the other side of the labia with the third leaf, get rid of that one. My fourth washcloth, I'm going to rinse the 2 parts of the groin. 1 leaf down one side, 1 leaf down the other side. I have now washed and rinsed the whole peri area. I'm going to take the towel and pat dry front to back, and then I'm actually going to just tuck the towel between the legs, undo the bath blanket for the patient to stay warm, and at this point I'm going to have the resident scooch toward me and roll away. And if you wouldn't mind just coming around this direction. What I have here is the pad and the towel that I used. I'm just going to tuck it under. Hugh, can I have you hold on to the resident, please? Thank you. For my last 2 washcloths, on the last washcloth with soap, I'm going to put soap on all 4 leaves. And I'm going to fold the leaves just like I did with all other cloths. And I pull out the top leaf, and it's going straight up the center from the anal area up towards the back. Then one cheek, the other cheek, and then the last leaf is coming straight up the back from the anal area up the back again. That was with soap. Now I'm going to rinse with clean washcloth with just water on it. 1 stroke. Cheek number 1. Cheek number 2. And up the center. I have now washed and rinsed the back. I'm going to start patting dry from the anal area up towards the back. Once I have washed and rinsed and dried that, I will roll the pad up and get it out of the way just in case I got it wet. I will put a new pad down there, tucking the clean pad underneath the dirty pad. Okay, Cassie, you're gonna roll over a bump, okay?
Okay.
And then I'll go to the other side of the bed. Please scooch towards me and roll away. I'm going to take the soiled pad, get it out of the way, unroll the clean pad, and we'll get you back situated in the middle of the bed. At this point, I can pull the sheet back up, get rid of the bath blanket. I don't want to touch the linens against my clothes as much as possible. I want to make sure that the resident is covered up, at least up to the shoulders. I'm going to lower the bed at this point and then take care of my exit steps. So I'm going to finish taking care of my linens. Since the bed is down now, it's safe for me to leave, and I can go to the sink. I can dump out the water, I can rinse it, and then dry the inside, dry the outside. Put my soap back in here. Use that same paper towel to open the drawer because my gloves are now dirtier than any of the surfaces. Get rid of my barrier into the laundry. Cassie, is there anything else I can get for you?
No, thank you.
That's good. The bed is in the lowest position and it's pretty neat. Call light is not in reach at this point, so I want to make sure I get that in reach. On the strong side. There you go. Feel free to call me if you need anything. Would you like a drink or something?
No, thank you.
Okay, and then I want to examine the overbed table because I want it clean, dry, and in reach so that Cassie doesn't fall out of bed trying to reach for something. I'm going to fling open my curtain. Remove my gloves. The first one comes off from the palm of the hand, the second one from inside. As soon as my gloves come off, I'm going to wash my hands or use sanitizer. Going to invite your family back in, Cassie, and then I'm going to go jot down my charting. Is there anything else that I need to take care of?
No, thank you.
Okay, thanks.